Although patient engagement is considered the cornerstone of the healthcare system for its positive impact on health outcomes and healthcare costs, patients have to be encouraged to become more involved with managing their own care. Patients need frequent real-time communication and feedback to support their health behavior change. Because of this, IT platforms are being used to enhance patient engagements in the healthcare process. These IT platforms can help improve the quality of care, support healthcare safety, and provide cost-effective health services for patients. In previous studies, IT platforms have been shown to improve health behavior and patient engagement, with a majority of these studies showing a high level of patient engagement. IT-based health interventions can provide necessary information and advice counseling related to certain diseases and conditions, such as mental disorders, smoking, diabetes, sleep disorders, cancer, etc., thereby encouraging healthy living. These health interventions can actually allow patients to engage in self-monitoring, which thereby directs patients towards healthy eating, improving medical adherence, enhancing exercise use, and more. This technology can be very effective and efficient since it's less expensive and therefore more people can afford to use it.
Even though the information technology that we have right now already shows improvement in patient engagement and health behavior, I think it can still improve in many ways. For example, one of the gaps that the first article discovered was about usability and how further improvement in this area is still needed. There are ITs in health right now that have poor interface design, which badly affects how these technologies are being used and their effectiveness in increasing patients' involvement in taking care of their health. One way that can help with this is to conduct user experience research on current ITs in health, like finding out what the users like about technology, what they don't like, what features they use, what they don't use, and also their thought process and experience with using the technology. I think knowing this can help better the interface design, which can improve patient engagement and health behavior even further.
This week's articles were really interesting, especially the second one, because we got to see how UCI is involved with healthcare and technology in our innovative growing world today. And we got to see how UCI biomedical engineers developed a wearable respiratory monitor with children's toys. So this design created by UCI biomedical engineers was really cool because it was a very inexpensive way to tackle this problem of respiratory illnesses in infants. And the reason why it was inexpensive was because they used the children toy Shrinky Dink, and they used the wires, they compressed it, and they made it with heat and a Band-Aid like material. And when used properly, it's placed between the 9th and 10th abdomen on the individual with the respiratory health problem. And it's very useful in common problems today like asthma, because it could warn the user of an oncoming asthma attack so they can prepare and possibly get their inhaler or seek medical attention immediately.
Hi everyone, my name is Priscilla and I'll be speaking about the significance and further research about this week's article regarding the wearable respiration monitor. So this device was made to help children with asthma, cystic fibrosis, or other chronic pulmonary conditions. A quote that Professor Kine mentioned in this article that stuck out to me was, despite having his whole tiny body covered in sensors, all the hospital staff could get was his respiration rate information. If you looked at the vitals monitor, you'd see this waveform. So it looked like they were getting his respiration volume information, but they weren't. So that being said, even though the hospital staff could measure how fast or slow the baby was breathing, they couldn't measure how much oxygen the baby was actually receiving. I honestly can't say I know exactly how Professor Kine felt in this situation, but I understand how concerned a mother can be to see her newborn baby in a state of critical health. So by innovating an idea this inexpensive yet technologically advanced enough to be used daily, it's a great way to make a necessary health device more accessible to a wider audience. According to newmedia.org, it is estimated that 77% of Americans have mobile devices at their smartphones. With using thin, small sheets of plastic that have been inspired by Shrinky Dinks to create their sensor, this device can eliminate some stigma around wearing health devices that are visible to the public, as well as encouraging parents to be more adamant and aware of the potential health risks their children may face without stopping their kids from enjoying their daily lives. And thank you.